More than 2 million Americans suffer from atrial fibrillation, a condition in which the upper chambers of the heart quiver instead of beating rhythmically. This can cause blood to remain in the atria where it can form clots, and that's a problem. Today, one solution is catheter ablation for heart rhythm problems. Since February is Heart Health Month, we've asked Dr. Devi Nair, Director of Cardiac Electrophysiology for St. Bernard's, to join us today. And thank you so much for being here.
Thank you, Dana.
What is ablation? When you mention that, people just don't understand. How does this work?
Okay, so catheter ablation is a very specialized heart procedure that's catheter-based. And it targets electrical short circuits in the heart that cause heart rhythm problems. So during a catheter ablation, almost all of the time, people are put to sleep. You get little IVs in your groin, and through that we float little electrical wires up to your heart. Once the wires are in the heart, we use a specialized mapping system, which is kind of like the GPS system for the car.
Okay.
And it's a navigation system that helps us figure out exactly where the short circuits are in the heart. And once we figure out the short circuits, we go and cauterize them or we freeze them away, and that fixes your heart rhythm problem.
Now, sending energy impulses to my heart makes me just a little nervous, but should we be concerned? Is this rather routine these days?
It is a minimally invasive procedure. It does come with its risks and benefits. So if you have a heart rhythm problem, you have to discuss the risk and benefits of this particular procedure with your cardiac electrophysiologist and decide whether it's safe for you to have a cardiac ablation procedure or whether you take medications. But most of the time, it's a very low-risk procedure as long as it's done in a very safe environment.
Right. Now, who should think about having this done?
So as I said, the cardiac ablation procedure targets short circuits in your heart that cause heart rhythm problems. So if you have any kind of heart rhythm issues, the usual signs of it being palpitations, or you're feeling like your heart's pounding or racing, if you have passing out spells where you suddenly collapse, if you have dizzy spells, if you have pacemakers or defibrillators that are shocking you, or anything of that sort, those are the patients that will benefit from this procedure.
And maybe not have to take medication after all that.
Almost majority of the time, we are able to take you off of the medications, even blood thinners, very safely after the catheter ablation procedure, because the actual procedure fixes the problem.
That sounds wonderful. Dr. Devi Nair, thank you so much for joining us here at February Heart Health Month. Thank you.